So we're just going to get started. It's already 12, and thank you very much for joining this webinar series. So to get started, I just want to have a brief introduction about this webinar series. So this is the most recent effort our UGA Dairy team made to start this webinar series. Make it here. So this is actually organized by the UGA Extension and the UGA Dairy team. So the goal of this webinar series is to showcase the recent research in dairy production and also to discuss some emergent issues in the dairy industry. So as right now, so we do plan to deliver these webinars every 3 months, but the frequency can be increased if the demand is high and also if there's some emergent issues in the dairy industry came up, and we're just trying to have a timely discussion. So we do welcome webinar ideas from the dairy producer and also from the industry personnel. And also we also welcome some sponsorship. So this webinar series will be initially sponsored by a USDA CARE grant, but this grant will expire next year. And so in order to maintain this webinar series, we are currently considering sponsorship. So if you have some webinar ideas or you are willing to make some sponsorship, please contact us. And also, this webinar will be recorded and posted on the UGA Dairy Team website and also our YouTube channels. So for those who are online, if you have questions, please type in the chat so everybody can see. Um, so today I'm very happy to kick off this webinar series. So for those who don't know me, my name is Sha Tao. I'm on the faculty at the Department of Animal and Dairy Science at the University of Georgia. I'm part of the UGA Dairy team. So today I'm very happy to just share some of the recent research from our UGA Dairy team at the University of Georgia and related to management during the transition from late lactation to the early dry period. So for dairy cows, so during her lactation cycle, we know that the cows can face different challenges, and there are certain period of this during her lactation cycle. So the cows may face more challenges than other period. So one of the periods which is well known is the transition period from the late gestation to the early dry period, and this period is characterized as by the negative energy balance, dysregulated immune function, and also the increased disease instances, including both metabolic diseases and also the infectious diseases. So this period is quite important for the dairy management on farm. However, during this lactation cycle, there are other periods we also need to pay attention on, which is the transition from the late lactation to the early dry period. And this period is also associated with the optimum cattle productivity and health. And this transition are important because of several reasons. So first, we know that the early dry period actually is marked with a Murmy involution, which basically is to eliminate the senescent Murmy cells from the previous lactation and to promote the subsequent growth of the Murmy gland. And this is actually closely relates to the subsequent lactation performance. So when we talk about the dry period for dairy cows, so we need to actually focus on the mammary gland. So during the dry period, the mammary gland can experience a series of cellular events, which include the partial regression, which basically is the mammary involution, and also the mammary regrowth. And without this optimum cellular process, so the milk production of the cows will decrease in the subsequent lactation. For instance, so in this particular study, the scientists actually continuously milk the cows throughout the entire late gestation. So basically, they skipped the dry period or mammary involution. And also, they have cows have a typical 60 days dry period. And you can see here in the subsequent lactation, the cows without the dry period or the mammary involution actually have about 25% lower milk yield in the subsequent lactation. This emphasizes the importance of the mammary involution and the dry period on cows' milk production in the subsequent lactation. And we do think that is because the mammary involution can drive some of the mammary growth of the mammary gland during the dry period. For instance, in this study, which we conducted several years ago, we tried to characterize the mammary cell proliferation or mammary growth pattern of the cows during the dry period. So in this study, we collect the mammary tissues during the transition from the late lactation to the early dry period, and then we look at the mammary cell proliferation within the mammary tissue. And here you can see, so after dry off, so the mammary tissue actually start to grow and peak at the 7 days after dry off. This do suggest that the mammary evolution can drive a part of the mammary growth of the cows in the late gestation, which also explain why the mammary evolution is associated with the subsequent lactational performance. So clearly, from this data, we know that the early dry period or mammary evolution is critical for the cow's productivity. In addition to that, so we know that early dry period is associated with increased intramammary infection. Actually, during the cow's lactation cycle, there are two waves of increased intramammary infection. One is around calving, but the other one actually is right after dry off. And actually, for mastitis occurred in the early dry period. In the early lactation. About 50% of the mastitis caused by environmental pathogens can be traced back to early dry period. So this period actually is very critical to maintain the optimal mammary health in lactating dairy cows. So we can see, so the early dry period is not only can influence the productivity of the cows, but it can also affect the mammary health of the cows. Therefore, this transition need to be emphasized, and we need to actually to optimize the cows, optimize management during this transition. However, and unfortunately, so there are a lot of events can occur during the transition from the late lactation to the early dry period. For instance, the cows are normally regrouped from the lactating pen to the dry cow pen or dry cow pasture. And sometimes in some of the farms, so this regrouping also includes transportation from one farm to the other farm. Actually, this regrouping is a stress event for the cows that can induce a physiological stress response. So here is the data we collected in one of our experiment. So we can see here, so on the day of dry off, so the cows actually have higher plasma cortisol concentration compared with before dry off or after dry off. So this plasma cortisol concentration actually is a very good indicator for dairy cows' stress response. And this type of data do suggest that cows during the dry off actually experience upregulated stress, physiological stress. And we know that the cortisol actually can suppress the immunity and is associated with impaired immune function. In addition to this, and during this transition from lactation to the dry period, the cows also experience dietary changes. And so commonly, so the cows will transition from the energy-dense lactating cow diet to the far-off diet. And so this is a pretty significant changes in terms of diet because the far-off diet has a lower energy content and a lower nutrient for the cows. But in addition to this, so during this transition, the cows also have a pretty significant reduction in dry matter intake. So here is a couple studies. One is from the Dr. Jeff Dawes lab at the University of Florida, the other one from Italy. We can see pretty consistently. So relative to the cows in the last week of the lactation, so that once they go to the dry period, in the first week of the dry period, they actually have about 40% reduction in dry matter intake. And this coupled with the significant dietary change actually will lead to a very significant reduction in energy and nutrient intake of the cows during the transition from lactation to the dry period. And as a consequence, these cows will actually experience a temporary negative energy balance. So here is one data from one of our studies. We look at the plasma NEFA concentration. We can see here, especially during the first several days after dry off, so the cows will have increased the plasma NEFA concentration compared with the pre-dry off level. And so this indicate the cows actually in the early dry period experience some degree of the negative energy balance and adipose tissue mobilization. But the one thing I want to emphasize here is that this level of the negative energy balance is much less compared with the one in early lactation. But still, we know that the negative energy balance is also associated with the compromised immune function of the cows. This could have some indication on the disease instance of the cows in the early dry period. So in addition to regrouping and the dietary changes, apparently, so when the cow were dried off, particularly for those that were dried off abruptly, so they will experience other engorgement. This actually is a stress response, stress events, and also will cause discomfort and alternation of a cow's behavior. And so this is particularly important for high producing cows at the dry off. But the other thing about related to other engorgement actually is milk leakage. And we know that the milk leakage is also a risk factor for the development of the new intramammary infection. So although nowadays most of farm are using internal T sealant, but with the more significant other engorgement, so the cows still will experience the milk leakage. So here is the data set in one of our experiment. We actually follow up cows, about 160 cows, and to look at their milk leakage. In this particular farm, we actually they all the quarter were infused with internal T sealant. But still, you can see at the first day after dry off, there's still about 11% of the cows or 4% of the quarters experience milk leakage. Because milk leakage is a risk factor for the new intramammary infection, so this will actually eventually become an issue from the mammary health standpoint. So therefore, you can see during the transition from the late lactation to the dry period, there are a lot of things going on. But one of the things that we cannot see, we do not discuss is inflammation. But what is inflammation? So inflammation actually is a normal innate immune response of the body in response to infection or injury. And when the inflammation can be controlled, so the inflammation actually is necessary and good for the bacteria or pathogen clearance and also the wound healing. However, if it's not uncontrolled or we cannot control well, so the inflammation can actually compromise the animal's productivity and health. And one classic example of inflammation is mastitis. By definition, mastitis is the inflammation of the mammary gland. So, but what inflammation can do in dairy cows? So, one of the we actually can get some information from previous studies conducted in the lactating dairy cows. So here is one of the study we conducted. In this study, we try to induce the systemic inflammation in mid-lactating dairy cows by intravenous infusion of lipopolysaccharide. which is a component of the membrane of E. coli. And so infusion of the LPS can induce a pretty significant systemic inflammation. And then we follow up the cow's milk production. You can see here, from here to here, basically is before infusion and after infusion. You can see once the cow experiences upregulated systemic inflammation, so the milk synthesis has been reduced. It do suggest that the systemic inflammation can reduce the milk synthetic capacity of the mammary cells or the mammary gland of the lactating dairy cows. And in the other study, so we can look at this in the opposite way. So this is a study conducted by Dr. Barry Bradford several years ago. In this study, they actually gave the fresh cows NSAID, the non-steroid anti-inflammatory drugs, to suppress the inflammation associated with the early lactating cows. And you can see here, they have two NSAID drugs and also control animals who did not receive any treatment. And we can see here after during the lactation, so compare with the control cows without receiving the NSAID, the treatment cows who received the NSAID actually produce more milk throughout the entire next lactation. This do suggest that when we manage the inflammation or reduce the inflammation in early lactation, we can promote the mammary cells synthetic capacity throughout the entire lactation. So clearly here we can see that the inflammation can influence or either directly or indirectly influence the mammary gland function and also influence the milk synthetic capacity of the mammary gland. But how about in early dry period? So the first question we want to ask is if the cows in the early dry period actually experience inflammation. And here is the one early study we conducted. In this study, we just want to see if the cows in the early dry period experience inflammation. And so we actually follow up several cows to look at their plasma hemoglobin and blood fibrominogen. Both are markers for systemic inflammation. And we can see here when the cows are dried off, after cows are dried off, so their circulating hemoglobin and the fibrominogen do increase. And particularly on the 7 days after dry off, this value peak. So this do indicate that the cows in the early dry period also experience the inflammation. But where is the inflammation come from? So there could be several causes. The first one could be a dietary change and a decreased dry matter intake. So there are research to show with a significant reduction in nutrient and energy intake, so the cows can experience increased systemic inflammation due to the compromised gut integrity. Additionally, so the regrouping stress and also environmental stress after dry out, particularly the heat stress in this part of the country, and so can also increase the systemic inflammation. And so there has been report to show that the milk yield at the dry off is also positively associated with the inflammation in the early dry period. So do suggest that the stress induced by other engorgement also is associated with the inflammation in the early dry period. And the other thing we normally don't think about is the dry cow vaccination. So in most of the farms, cows receive vaccines on the dry off or around dry off. But for vaccines, particularly against the gram-negative bacteria, they can actually induce a very significant increase in systemic inflammation. So you can see this increased inflammation could be a multifactorial. So it's not just the one thing could influence the inflammation. But how the inflammation in the early dry period could affect the cows. So we do hypothesize in the short term, this upregulated inflammation could alter the animal's stress response and cause the discomfort of the cows. This could alter the animal's behavior and also their well-being. Additionally, that could also influence the immune function of the cows in the early dry period. However, in the long term, we do think this could alter the animal's milk yield in the next lactation by influencing the mammary gland development and potentially can increase the animal's disease instance in the subsequent lactation and impair animal health. And if we can manage the systemic inflammation in the early dry period, we have an opportunity to to improve milk production and also increase the profitability. But how we can manage inflammation around dry off? So now I want to just discuss three experiments and three approaches we conducted in the last several years in the effort to manage inflammation around dry off. And the first one is to decrease milk yield before dry off. And there, as mentioned before, there are reports to show the milk yield at the dry off is positively associated with the degree of the inflammation in the early dry period. In other words, for high producing cows, they can experience more inflammation in the early dry period. So one way to minimize the inflammation in the early dry period is to decrease the milk yield. And for the second approach, is more obvious. It's just to advance the dry cow vaccination, which basically is to perform the vaccination to the dry cows or to the cows that dry off earlier. We can do this 1 or 2 weeks earlier. And the last one we did is to look at the use of the NSAID or the non-steroid anti-inflammatory drugs to further reduce the cow's inflammation in the early dry period. So now I just want to share three studies with you to discuss these approaches one by one. For the first study, and our objective is to look at if we can minimize inflammation and alter animals' future performance by reducing the milk yield of the cows before dry off through the reduced milking frequency. So this study was conducted in a commercial farm located in central Georgia. This farm, the average milk yield is about 40 kilo per day. And in this particular study, the vaccination protocol is include 3 vaccines, and also the vaccine will perform about 3 weeks before dry off. So we performed the vaccine earlier just to avoid the interference of the inflammation induced by vaccination. And for all the cows were housed in a freestall barn until calving. So in this particular study, we enrolled over 1,000 cows. And so for control cows, so the or 3X cows, they actually were milked 3 times a day in the last 13 days before dry off. And this is based on the farm's protocol. So they normally milk this cow 3 times per day until dry off. And for our treatment cows, we actually milk them about 2 times per day or 2X cows for the last 13 days before dry off. And to achieve the treatment, we actually skip the one milking or the last milking of the day. So in other words, for this 3X cows, they can be milked every 8 hours. But for the 2X cows, they were milked between the first milking and the second milking is about 8 hours. But because we skipped the last milking of the day, so from the second milking in the first day until the first milking of the next day, the interval is about 16 hours. Please keep this in mind. And so in this study, we also collected some blood samples to look at the inflammation markers. And very special thing about this farm is that they actually collect the composite milk sample from all fresh cows within 3 days after calving to do bacterial culture. We can take advantage of that to look at how the treatment affect the bacterial culture in early lactation. So this is some of the result from this study, and here is the milk production before dry off. And we can see here before the treatment, and all the cows had a similar milk yield. However, on the first day of the treatment, relative to the 3X cows, which is here, the 2X cows have about 50% reduction in milk yield. So this is a very significant reduction. And we don't think it's only because of the reduced milking frequency. So to achieve the treatment, we have to move the cows from one pen to the other. So there is also a regrouping stress in the mix. So we do think there's a significant reduction in milk production. It's a combined effect of the reduced milking frequency and the regrouping stress. But you can see as the time went, so the differences between treatment become smaller. And on the day of dry off, the differences is about 10%. So we also look at the plasma haptoglobin as a marker for systemic inflammation. But in this study, we actually did not see any differences between treatment. But in this study, we only collect the samples on the first day, on 1 day after dry off, and 8 days after dry off, or uh, 9 days relative to dry off. So one of the potential reasons why we did not see differences probably is because there's an infrequent sampling timeline. So this is one of the weaknesses of this study. So before I move forward, I did not include the data here, but we actually did not see any differences between treatment for the milk production in the subsequent lactation, suggesting reducing milking frequency in the late lactation or before dry off actually did not influence the productivity in the subsequent lactation. However, interestingly, we do see some treatment effect for the cultural positive rate. So as mentioned before, this farm, they actually collect all the composite milk sample from all fresh cows and to culture to determine if they are infected with bacteria. And so we can take advantage of that to look at if the treatment could affect the bacterial infection in early lactation. And so for primary counts, here the primary counts and multi-parts counts are defined based on the parity of the counts when we enroll them. So basically, the primary counts, they were on the first lactation when we enroll them before dry off. And the multi-parts counts, they were on second or more lactations when we enroll them. And we can see for primary counts, so there actually no difference for the cultural positive rate. However, for the multi-parts cows, we do see that relative to cows milked 3 times a day in the late lactation, so the cows milked 2 times a day actually have a greater cultural positive rate. And this greater cultural positive rate is primarily due to the environmental pathogens. But when we look at the mastitis rate, we actually did not see significant differences. So what's the reason for this difference for multi-parts cows in the cultural positive rate? So we actually don't know, but our interpretation here is that this could be related to the milk leakage. As mentioned before, when we abruptly dry the cows off or stop milking, so we'll have other engorgement that will lead to milk leakage. But in addition to dry off, some other situation can also cause other engorgement and milk leakage. For instance, in this particular study, so we actually skipped the last milking for 2X cows. So the interval between the second milking in the first day to the first milking of the next day is about 16 hours. So in this long interval between milkings, so that could also cause other engorgement and also leading to the increased milk leakage. That will give a chance for bacteria to get into the mammary gland, causing some infections. So this is potentially one reason why for cow milks, 2X a day can have some increased cultural positive rate in the subsequent lactation. So for this study, so we do see that reduced milking frequency in the late lactation could reduce the milk yield by 10 to 50%. And the duration actually matters. If you remember the figure at the beginning of the treatment, so the differences in milk yield actually is bigger than later. So if you really want to implement this strategy on the farm, so we do recommend to do this shorter. Do not do 2 weeks. You can do about 3 days, or maybe from 2 to 3 days to about 7 days. And however, in this study, we actually did not see any differences on systemic inflammation, but we do see that when we milk cows twice a day, we increase the cultural positive rate at calving, so which actually is not very ideal from the marmot health standpoint. And also, we did not see differences in subsequent lactation performance. So one thing I want to point out here is that in this particular study, what we learned is that this for our personal opinion. So what we learned is that if you have a high producing cows and your dry cow facility is clean, we really don't think it's necessary to reduce milking frequency in the late lactation, because that can potentially increase the new intramammary infection by increasing the milk leakage. So, but I think the data also is should dependent on different farms, and the different farm situation could have different approaches. So clearly, at least in this study, we did not see the differences in memory inflammation. So we need to figure out the other way to control memory inflammation, and which is the advanced dry cow vaccination. So to study this, we conducted a second experiment. So in this experiment, our goal is to examine the effect of a different vaccination schedule before dry off on systemic inflammation and subsequent performance of dairy cows. So this study was also conducted in a commercial farm, and so the farm average milk yield is about 45 kilo per day. And the for the farm protocol, the vaccination protocol for the farm is that they actually gave a vaccine to the dry cows or give vaccine on 2 days before dry off. And so this is just their protocol to facilitate the hoof trimming, etc. And for housing and the lactating and the close-up cows were housed in a freestyle barn, but the far-off cows were housed on pasture. So in this particular study, we enrolled a little bit over 300 cows, and we have two groups. The first group we call it the SOP cows or control cows. So they actually received vaccine about 2 days before dry off based on the farm's standard operating procedure. And for vaccinated cows or EV cows, they will actually receive vaccine about 11 days before dry off. So in this study, one thing I want to point out is that in this farm, they actually adopted the approach to reduce the milk production of the cows before dry off. So basically, from 2 days before dry off until dry off, they actually milk cows once a day and only provide hay. So basically, it's a combination between reduced the milking frequency and the nutrient restriction. And so in this study, we also collect the blood sample to look at the systemic inflammation marker, and we actually also did some immune function analysis, which I'm not going to discuss here. So here is the data, and so this is the milk yield data before dry off, and you can see so on day 11 after vaccination, so for this EV cows, their milk production start to decrease, but however the production actually went back, and become similar with the control cows on 5 days after vaccination. And you also can see here, so from 2 days before dry off to 1 day or to the day of dry off, there's a significant reduction in milk production. As I mentioned before, it's primarily because of the reduced milking frequency and the nutrient restriction of these cows. So here is the plasma haptoglobin concentration. Again, so this is a marker for systemic inflammation. And you can see here, this is for the early vaccinated cows. So after vaccination, their haptoglobin concentration increased and then went back to baseline level about 2 days before dry off. But for the SOP cows or control cows who receive a vaccine on day two before dry off, they have upregulated systemic inflammation right in the early dry period. So this data do suggest that our treatment was successful, and when we perform vaccine earlier, we can actually shift the inflammation, the upregulated inflammation from um, early dry period to the late lactation. So I just want to show you some like a key finding from this study, and one of the key finding here is actually milk production. And we look at milk production and also separate by Parameter and the multi-Pascals. Again, so the Parameter is the cows who are on the first lactation when we enroll them, and the multi-Pascals are cows they were on the second or more lactation when we enroll them. And we can see here, so we actually did not see differences between treatment for Parameter in the subsequent lactation. However, when we look at the multi-part cows, we do see that in the subsequent lactation, the cows who received vaccine earlier actually produce about 1.9 kilo per day more milk in the subsequent lactation. So this probably about 3 to 4 pounds of milk, and you can see the pattern. So the increase in milk production kind of like throughout the entire lactation. So we also look at the energy cracked milk, and so you can see similarly for primary parts cows, we did not see any differences. But for multi-parts cows in this particular study, for when we gave vaccine earlier before dry off, we actually these cows can actually produce about 2.7 kilo per day more energy cracked milk in the subsequent lactation. So this do suggest that the systemic inflammation in early dry period can actually influence the mammary gland development and also the future milk production. And if we can move the vaccine schedule earlier, we can probably can increase the milk production of the cows. So additionally, we also look at disease instance, the reproductive performance, and the coding of this cows in the subsequent lactation, and we actually did not see any differences. So just to several takeaways from this study, and so giving vaccine earlier or giving vaccine earlier in the late lactation can actually reduce the milk yield in the late lactation, and and also can lower the systemic inflammation in the early dry period. And so in this, the one important finding of this study is that so giving vaccine earlier before dry off can improve the yield of milk and fat in the multi-part cows, but not in the primary part cows. So I did not show data, but actually we also see a significant difference on the fat milk fat production between the early vaccinated cows and the control cows, and it has no impact or a negative impact on animal health, survival, and reproduction. So for us, and we do think alter the vaccine schedule around dry off is a valid approach for improving milk production in the next lactation. But we do have several limitations in this study. So if you remember, in this farm, they actually use a pretty effective approach to lower milk yield at dry off. So this cow will actually dry at 8 kilo per day, so it's relatively low. So that probably can mask some impact of this approach on memory health. And additionally, actually, for study to examine the health and the repro and the survival, the animal number in this study is relatively low. This probably is one of the reasons why we did not see any differences in animal health parameters. So I do think we need to do more research in to repeat this study with large animals and see if altering the vaccination protocol can influence the animal health and survival of the animals in the subsequent lactation. So the last approach we actually tried is to use the NSAID, the non-steroid anti-inflammatory drugs. So as we talked about before, so in addition to vaccination, so the increased inflammation in the early dry period is multifactorial. And so we do think if we can use this NSAID drugs to further reduce the inflammation, we probably can have a better influence. We probably can make a cow have better productivity in the subsequent lactation. So that's our third experiment. And then in this experiment, well, our objective is to examine the effect of a different dry cow vaccination schedule and the administration of a non-steroid anti-inflammatory drugs on inflammation and the performance of the cows. So this study was also conducted in a commercial farm in Georgia. So the farm actually average milk yield is about 40 kilo per day. And on this farm, their farm protocol is to give a vaccine on the day of dry off after the last milking. And in this farm, the dry cows were housed on freestall barns until calving. So in this study, we did not enroll a lot of animals because one of the main objective of this study is to characterize the inflammation pattern around dry off. So the productivity data actually is not the main purpose of this study. So we did not include a lot of animals. So we totally include a little bit over 160 animals with the three treatment. So we have three treatment. The first treatment is basically to follow the farm protocol. So the cows were giving vaccine on on the day of dry off after the last milking and did not receive any NSAID. And for the early vaccinated cows, we actually give vaccine about 14 days before dry off. And they also did not receive any anti-inflammatory drugs. And the last treatment is called the early vaccination plus NSAID. So in this group of cows, they actually receive vaccine on 14 days before dry off, but on the day of dry off and 3 days after dry off, so they also receive NSAID capsules. So this in this experiment, we actually use molluscans to reduce the inflammation. So we actually take a lot of blood samples, try to characterize the inflammatory patterns of the cows in the early dry period. So here is the milk yield before dry off, and you can see here very similar to the second experiment. After we give cows a vaccine for this EV and EV plus NSAID cows, so they actually the milk yield actually decreased significantly. And as we mentioned before, in lactation, the upregulated systemic inflammation could reduce the milk production of the cows. But again, so by the 5 days after vaccine, so the milk yield actually went back to the baseline level and similar to the control animals. So here we look at the vagina temperature or body temperature of the cows, and also the plasma hemoglobin as the inflammation marker. We can see here after vaccination, the cows actually experience a feverish response, and also their plasma hemoglobin was increased, very similar to the second study. It do suggest that in this particular study, in this studies, so the treatment is working, and every time we give vaccination, the cows will have increased systemic inflammation. But one thing I want to point out here in this particular study, and if you look at this EV cows, which is the cows who receive vaccination early, so after dry off, you can see their actually hemoglobin or systemic inflammation marker did not change. This do suggest that in this particular study, so the vaccination is the sole reason for the upregulated systemic inflammation in the early dry period, such as the SOP counts. And here is the milk yield in the subsequent lactation. In this study, we hope we can replicate the second study to see differences in milk yield, but we didn't. So this data actually include both primi-powered counts and the multi-powered counts. But multi-part counts, you can see there's no differences. And then we decide to separate. So again, we look at primary part counts and the multi-part counts earlier, sorry, separately. And you can see here, and so again, no differences between treatment for primary part counts and for multi-part counts. We do see a treatment by time interaction, but on each time points, we actually did not observe any treatment effect. So one of the, I just want to point out in this particular study, our main goal is to look at the inflammation pattern after dry off. So we did not include a lot of animals, and that's probably is one of the limitation and one of the reason why we did not observe any differences in milk production in the subsequent lactation, like the experiment two. And you can see this bar is called arrow bar, and so it's pretty big relative to the means. So I decided to take out error bar and just to look at the numerical value, and here is the primary Pascal. But let's pay attention on this multi-Pascals. And so you can see, and if you can see here, um, compare with this control counts, this EV and the EV plus NSAID counts actually have a little bit better milk yield, especially after 15 weeks or after peak milk of the cows. So this, I do think is relatively consistent with our second experiment and suggesting the alternation of the inflammation in the early dry period can influence the mammary gland development and also influence the future productivity of the cows. So just some brief summarization of this experiment. So for inflammation, for vaccination, when we gave a vaccination earlier, it does can alter or reduce the systemic inflammation around dry off. But in this particular study, we did not see differences in lactational performance. And so this probably because we have a less number of the counts. And in this particular study, we actually did not see any positive benefit of NSAID or the non-steroid anti-inflammatory drugs on cow's immunity, inflammation, or future productivity. So this is something we think is a little bit against our hypothesis. And but at this point, we did not provide any evidence to show it will be beneficial to give cows NSAID on the day of dry off or in early dry period. So just the overall conclusion about this presentation. So we do think reduced milking frequency has no impact on inflammation, but could negatively affect the marmot health. But this need to be interpreted with caution because every farm have different protocol, and maybe the result we observed in our study is not going to be replicated in other farms. But I do think when we need to really think about the specific situation and also considering this data before we make a decision if you are going to reduce the milking frequency on your farm on the farm. Additionally, we do think advancing dry cow vaccination is a good approach, and it's an easy approach to potentially increase the milk production of the cows in a subsequent lactation. And at the same time, at this point, we did not see any benefit to include NSAID as a part of the dry cow management or dry off management on farm. So with this and so that's so everything. I just want to want to show my appreciation to all the students who conducted this study and also all the farms who allow us to work with them. So I'm blessed to be in Georgia and be surrounded by a lot of decent producers who are very supportive and to our program. So I also want to thank the funding agency. This study were funded by the Southeast Milk Checkoff and also a USDA NIFA care grant. So with this, and so we have several people online, and I'm be very happy to taking questions. So you can actually type your questions in the chat, So so for those who did not cannot make online or right now, so I'm going to we're going to post this presentation on our Georgia UGA Dairy Team website and also our YouTube channel. And I'm going to leave my contact info there. So if you have a question after listening this presentations, please feel free to contact me. So if no question right now, so I'm just going to stop and stop recording and also to stop this presentation. Thank you very much for everybody. And we are looking forward to have you in the future webinars. Okay, bye.